Hello and welcome to our online fertility awareness program, You and Your Fertility. This program is brought to you by Love Foundation and I am your host, Dr. Uju Eze. In this program, we teach basically what you as an individual can do to improve your fertility health. No doctors, no drugs. What you as an individual through your daily practices can do to improve your fertility and reproductive health. This particular series is the Fertility Diet series, where we are looking at different fertility related challenges and how we can manage them just by what we eat, by our diet. So we are at episode 9 today, and what we want to handle is PID, pelvic inflammatory diseases. So we want to look at what you can do as an individual with respect to foods that you eat that can help in the management of pelvic inflammatory disease. Stay with us. So before we get into the main details of foods, we want to first of all define what pelvic inflammatory disease is. PID, or pelvic inflammatory disease, is the inflammation of the upper tract of the genital tract. That is inflammation or infection of the upper parts of the genital tract. So we are looking at the organs that are located in the upper part of the reproductive system of the genital tract. So we're looking at the ovaries, the tubes, and then the womb. Of course, what we have in the lower part of the reproductive system or of the genital tract is the cervix and the vagina for women. Now, PID really affects women mostly. It mostly affects women. So we'll be narrowing this discourse to management of PID in women, because they're the ones that are usually more affected or mostly affected by pelvic inflammatory disease. So we have defined pelvic inflammatory disease, and we have said it affects organs like the tubes, the ovaries, and the womb. Now, the second thing we'll talk about is the actual treatment for PID. Foods will not treat PID. Let's establish that. Foods will not treat PID. PID is caused by bacteria, and what can treat it is antibiotics. Okay? So usually more than one antibiotic is used in the management of pelvic inflammatory disease. The best way to know the exact antibiotic to use is to run what we call the high vaginal swab test, which is commonly known as HVS, or the one women generally call infection test, the one where a swab is used in collecting sample from the upper part of the vagina, because we believe that whatever is causing the inflammation is exuding from the wherever it's happening down the tract and will come out in the vagina eventually. So the higher part around the cervix, we take the sample there to give us an idea of what might be happening in the pelvic region. How to know somebody is having pelvic inflammatory disease? The commonest symptom is pain. Pain, especially pain during intercourse, what we call dyspareunia. When a woman is complaining of pain during intercourse, she most likely has pelvic inflammatory disease. The pain can even continue outside intercourse, and so the person just has chronic pain around the waist or down the lower abdomen. The pain is always there, felt more on movement, maybe when you want to bend or lift something or change position while sitting, or sitting to standing, standing to sitting. Anything that moves the pelvic region will cause pain for the person, and sometimes the pain can be really, really intense. Some people can only manage the pain with strong painkillers like the NSAIDs, things like that, diclofenac and ibuprofen and cataflam and things like that. So that's the major symptom for pelvic inflammatory disease. Another symptom, of course, is discharge. Unusual discharge, not those whitish ones. This discharge is usually very foul smelling and has discoloration. Sometimes you can see discharge looking greenish or looking deep yellowish. Those are the kind of discharges that will make you know that this is not happening just in the vagina. This is likely something happening higher up around the womb the tubes or the ovaries. So following investigations, the doctor will prescribe, we have said, more than one antibiotic to manage the condition. Sometimes it can be up to 3 depending on the intensity of the condition. So this treatment should be taken. This is not the kind of antibiotics you take for 5 days or 3 days and stop. No, the drug should be taken for 10 to 14 days. Okay, depending on the severity again, though some doctors might look at the severity and decide to treat for 7 days, but usually this gold standard for the management of PID is to treat with antibiotics for 10 to 14 days. This is why it is bad to self-medicate, because if you are self-medicating, you might not know how many days you really require to clear the organisms. So the work of the antibiotics is to kill all the organisms that is causing the infection, and when that is done, some side effects might remain. Okay, so the challenge with the PID as a disease is that it causes scarring and inflammatory processes around the area, so that even after the organism is dead, some of these things might still be happening. The pain might still be there because of the inflammatory process that has taken place. Some of the scar tissues that might have been formed as a result of the inflammatory process of the disease as a whole. Some of this scarring can cause blockage in tubes. We've talked about that when we're talking about tube blockage. It can cause scarring in tubes, it can cause scarring around the womb, it can damage ovaries, and this is what can now impact fertility and cause infertility or difficulty in conception in those that are suffering the condition. So to the main topic, what foods can we use in the management of PID? So after taking the drugs, after taking antibiotics for 2 weeks, like we said, thereabouts, what can you now do on your own to improve the condition and remove the side effects or reduce them critically and help the body to come back to function in such a way that it can resume its function of reproduction, conception, pregnancy, and the likes of it? That's just what we're going to look at now. So aside the antibiotics, one of the things that you can do on your own that the doctor might not prescribe to you is to take foods rich in antioxidants. Foods rich in antioxidants, we have said this so many times, are foods that can help to calm down inflammatory processes in the body. So we are looking at our fruits, we are looking at our vegetables, we are looking at our micronutrients. These are the things that are very rich in antioxidants. I'm not going to be mentioning any specific fruits, but generally fruits and vegetables are rich in antioxidants and can help the situation. And then specific vitamins like your vitamin B6 is very, very good in helping with PID inflammation. And then other vitamins like vitamin A, your vitamin C. Of course, you know that vitamin C is one of the richest vitamins in antioxidant properties. So vitamin C and then vitamin E. So your B6, vitamin A, vitamin C, and vitamin E will help a great deal in reducing the inflammatory processes and helping the system to come back to normal. Another food that will be very good, the second one I will mention, is yogurt. Yogurt, we already know, contains probiotics. Okay, it contains probiotics, which is what we call good bacteria. So that good bacteria can also assist in fighting the bad bacteria that is in the body, dominating the environment, not allowing other bad bacteria to come and reside there. That is the essence of probiotics, and this we can easily find in yogurt. So food rich in antioxidants, foods rich in probiotic, particularly yogurt, will help in improving the immune function of the system and go ahead to eliminate free radicals. The main function of antioxidants is to eliminate free radicals. Free radicals are the things that cause this inflammation or inflammatory processes that we are talking about. So taking these two foods will help to combat the ongoing inflammatory process and help the system to come back to normal. Another food that can be helpful is a tea. This one is the garlic and turmeric tea. Garlic contains sulfur, turmeric contains its own active ingredient, and together they can come into the reproductive system and reduce the inflammatory process caused by PID, help to reverse whatever has been happening or what has happened there and get the body back to normal. Okay, so making garlic and turmeric tea can go a long way in the management of PID. It also helps to control the pain. It also really helps to reverse the pain and stops it. People that suffer chronic pain from this PID, even after taking antibiotics, some people still have pain. Remember, we said it's because of the inflammatory processes. The antibiotic has killed the bacteria, but the inflammatory process that is ongoing or that has happened or that has caused some damage can still lead to pain. So taking things like garlic and turmeric tea can help to reverse this pain. Another tea that people talk about is the guava tea. Okay, using guava leaves together with garlic to prepare a tea. Many people argue that this is also very good in combating the bad bacteria that thrives in the pelvic region causing PID. It also helps to reduce inflammatory processes and generally improve the symptoms of pelvic inflammatory disease. So it's something that has been shown to be beneficial in the management of PID. It involves taking guava leaves, okay, from the guava tree, of course, adding some garlic to it, boiling it and making a tea out of it, drinking it morning and night, and that will also help to improve the symptoms, improve the outcome of the pelvic inflammatory disease. So it's the same way that the turmeric and garlic is made. Add them in hot water. If you have the powdered forms of these two, add them in hot water and drink. But for the guava leaves, you have to boil them together with garlic and make the tea. Another class of food are foods rich in carotene. Okay, carotene is another element or nutrient that is useful in combating inflammatory processes in the body, particularly the one caused by PID. We can find carotene in foods like our mangoes, our carrots, of course, but mangoes, spinach, and sweet potatoes. Okay, these three are particularly very rich in carotene that will help in the management of PID. So just consuming these foods, at least 1 or 2 pieces of it once or twice daily, will help to contribute to the management and treatment of pelvic inflammatory disease. Another final tip is one that some people argue about. Some people are not really comfortable with it, but some people have said that it has been shown to be beneficial. It is the intake of baking soda. Don't laugh at this one, but yes, some people it has been known to be one of the hacks in treating pelvic inflammatory disease. One of the reasons is because it is said that pelvic inflammatory processes happens in an acidic environment. The bacteria that causes this PID thrives in an acidic environment. So some people argue that if you take a teaspoon of baking soda, which is very alkaline by the way, just mix it in water and drink during the process of having this PID, it neutralizes that acidity and makes the bacteria weak, so they can easily be killed by the antibiotics, and every other thing we are doing can help to eliminate them faster. So some people argue that the intake of baking soda can help improve PID symptoms and also contributes to the management, but it's for you to find out. So we have talked about the things that we can do to help in the management of PID. What are the things that we need to avoid? That is also very important, even as important as the thing that you need to do. The first thing that you must avoid is casual intercourse, casual sex. You must practice safe sex if you are going to stop yourself from continually having PID. Safe sex includes being faithful to one partner and also using condom as much as possible if you are not if you are not a married person. So you use condom as much as possible so that you avoid contracting sexually transmitted diseases, because sexually transmitted diseases is the beginning of every PID. So avoiding casual sex, practicing safe sex will help in controlling exposure to PID. The second thing that is important to note is that the partner must be treated. The partner must be treated every time a woman is being treated for PID or even sexually transmitted disease. The same antibiotics that have been found to be effective for her must be given to the partner as well. And it is recommended that during treatment there should be abstinence. And if that abstinence is not possible, like 2 weeks is a long time, condoms should be used for intercourse in that period of time so that there won't be what we call a reinfection. Once these organisms keep coming back, it becomes difficult to treat with antibiotics because they develop what we call resistance to the antibiotics, and so you take these antibiotics, they are no longer working. So it is best to even prevent having them as much as possible. Another thing is that the women can always disinfect their underwear after treatment. That is to prevent the hibernation of spores of these organisms that, when you have discharge, it is the exudates from the bacteria that is coming out as discharge. So some of the spores of those organisms can be in those discharges, and when they stay on the underwear, they can just stay there, and just common ordinary washing might not completely kill them. They are very fastidious. They can attach themselves to the fabric of your underwear and be waiting for an opportunity to come back to life. Okay, so it's important to disinfect underwear if you cannot change all of them. If you can change them, that's the best, but if you cannot change them, disinfect them with things like bleach, okay, whatever brand of bleach you use, or with other antiseptics, strong antiseptics that will make sure that whatever organism is attached to those underwears die off completely. Always try to hang the underwears in the sun. The sun is another powerful tool for killing these organisms, drying the underwear completely and not allowing any environment for those spores to thrive. Okay, and the final point of what we have to do is to avoid douching. Women, I say this as much as possible every time I have the opportunity. Avoid douching. Douching removes dirt, yes, but it will also remove the good bacteria that are in the genital tract. Those good bacteria, remember we talked about taking yogurt. Some people even advocate applying yogurt in the genital tract, that is pouring yogurt into the vagina, because the good bacteria that is in yogurt can help to fight off the bad bacteria, dominate the environment, and not allow those bad bacteria to thrive. Some people say that can be helpful, but at least taking it also is very important. It's also very useful. But douching means washing the vagina with soap and water, putting your hand inside the vagina and washing it, applying soap. I've come across somebody who said they applied bleach to wash the vagina. These are terrible practices that keeps exposing women to infections. So stop douching. The vagina cleans itself. It has cells. The cells are programmed to clean out the vagina. When you menstruate, you don't do any extra work, but all the blood just comes out, and after some time everything is out, and then the next thing you see that normal whitish discharge. That means the vagina is clean. You didn't contribute to that. So douching is a very bad practice that encourages growth of bad bacteria in that vaginal environment. Avoiding it is one of the easiest ways to avoid contracting sexually transmitted. Well, let me not say sexually transmitted diseases, but bad bacteria. Okay, bad bacteria in general. Because if you have good bacteria thriving there, it dominates. It has this. They have this territorial nature. They dominate that environment and prevent bad bacteria from having any place to come in and grow. So avoiding douching is one of the most important points for avoiding pelvic inflammatory disease. This is where we'll be stopping in this episode. We hope you have learned something. Remember our slogan: learn to teach others. Whatever you learn concerning these reproductive health issues, please pass it on, because people need to know these things, have the right information, start putting them into practice, and before you know it, we are all helping each other to come out from reproductive health challenges. Until we come your way again next week with another important topic related to fertility diet. Stay blessed, keep following us.